Hi guys, so in today's clinical case study session, we have a patient who comes to you who is in her late 30s. She has recent weight loss and she's also complaining of loose stools. And when you examine her, you find that her eyes are protruding, which is very obvious, and then you find her skin is dry and warm. Apart from that, she has an enlarged thyroid gland or enlarged region in the neck, and her vital stats are 110 beats per minute, and then we also have her BP, which is 143 bar 83 mmHg. Now, this particular patient, from her findings, especially from the protruding eyes and the enlarged thyroid gland, you can come to a diagnosis or conclusion of Graves' disease, which is a form of hyperthyroidism. Okay, now before going on to Graves' disease, let's talk a little bit about hyperthyroidism. Okay, so basically, hyperthyroidism, or it's also known as thyrotoxicosis, both are analogous because hyperthyroidism is basically your increased production of the thyroid hormones by the thyroid gland. All right, and thyrotoxicosis, you most often find this. So coming to the thyroid gland, a little bit about the thyroid gland. So basically, you have the hypothalamus in your brain, which controls the release of these thyroid hormones. How is that? If you have a look at the small picture that is drawn in this particular presentation, you will find the brain releases, or the hypothalamus releases, something called as the thyroid releasing hormone. Okay, and that thyroid releasing hormone, TRH, okay, it acts on the anterior pituitary, the pituitary gland, which is present. You find that in the anterior part of the pituitary gland, a particular hormone is released, and posterior secretes other hormones. That will leave for another day. So the anterior pituitary releases this particular hormone called the thyroid stimulating hormone in response to the thyroid releasing hormone. Okay, so this thyroid stimulating hormone is basically released by the anterior pituitary, which acts on the thyroid gland. So these thyroid gland, okay, just imagine it to be having many cells. All right, and these cells are the follicular cells. Now these cells have certain receptors. All right, so every cell has a receptor which will release one particular hormone or enzyme or whatever it is. So these cells in the thyroid gland will release the thyroid stimulating hormone. So what happens in Graves' disease is basically your these follicles, okay, or these cells, they get activated. All right, so they get activated, and they in response to the thyroid stimulating hormone, they start releasing a lot of thyroid hormones. Okay, so basically here you have the thyroid hormones are your T3 and T4. In your Graves' disease, you find, the most very obvious finding is your increased T4. Okay, basically increased thyroid hormones, but your increased T4, your free T4, okay, thyroxine. So your T4 is increased, okay, because the cells get activated and they release the T3 and T4. Now what exactly happens is, now how do these cells get activated? It's basically because of your auto antibodies. Okay, so that way basically this Graves' disease is an autoimmune disease, okay, along with your other conditions like Hashimoto's thyroiditis. All those are also autoimmune conditions. So here your Graves is also an autoimmune condition where what happens is the auto antibodies, okay, they get activated and they will activate the cells. Okay, the auto antibodies will activate these cells to increase the amount of T3 and T4 that is released. Okay, so these auto antibodies are also called as thyroid stimulating immunoglobulins. Okay, so immunoglobulin is your antibody, right? And your auto antibody is basically the one which is activating. So thyroid stimulating immunoglobulins will activate the cells, and it will start taking up TSH and releasing more of your T3 and T4. All right. Okay, so basically here you need to know how do you diagnose this Graves will be from increased T3 and T4, basically T4, and also there is a fall in your thyroid stimulating hormone. Okay, so there is a fall in the TSH levels, and then there is an increase in T4 and T3. So you also know, apart from the increase in T3 and T4, there might also be an increase in your TSI, okay, thyroid stimulating immunoglobulin, or the auto antibodies. Okay, moving on to, so we know the diagnosis part. Now coming to this hyperthyroidism, right? So other than Graves, you also have conditions where you have hyperthyroidism. Graves is basically a diffuse enlargement. Okay, what are the conditions where it will be probably nodular rather than diffuse? So when you have your nodules, it can be one nodule or it can be many, right? So you have conditions where you have multiple nodules, as well as you have single nodules. So where you have a painless nodule, you have this disease called Plummer's disease, right? So Plummer's disease you have painless nodules. Okay, that is found in Plummer's disease. But in Graves, it will be not nodule, but it will be a diffuse enlargement. Another condition would be your where you find multiple nodules would be your toxic multinodular goiter. That is another condition where you have hyperthyroidism. Okay. Apart from that, you also have hyperthyroidism in conditions like thyroiditis. It can be also because of medications like amiodarone, as well as it could be because of alpha interferon medication, as well as lithium medication. So these are other reasons why you might find a condition of hyperthyroidism. Okay, now moving on to our present case, the lady who's in her late 30s who is presenting with a diffuse swelling. So you've concluded it's a it's a Graves' disease. So usually Graves' disease is found in patients between 30 and 50 years of age. Okay. Apart from that, it's seen mostly in the women, and it could also be a hereditary condition. Okay. And coming on to the clinical findings. So now for clinical findings, you can distribute, or you can, how do you remember what are the clinical findings? You can divide them into various systems. Okay. So coming on, first of all, remember it affects mainly your heart. Okay, it's very important. So it affects the CVS. So how does it contribute? It basically brings, for example, you see in this patient, you find her BP is increased. So remember that in Graves' disease, there's an increased heart rate, tachycardia. Okay, which can also lead to fibrillations. Okay, so you have tachycardia, you have fibrillations, increased heart rate. It can also lead to heart failure. Okay. Now moving on to the other systems like your CNS. Okay, CNS mainly remember the eyes. It's very important. So in this patient, her eyes were protruding, right? So that's a condition called as exophthalmia. Okay, exophthalmos or proptosis is basically what happens is the sclera around the iris is visible. Usually for a normal person, all around the iris, the sclera is not visible. It's just on the sides. Sometimes, by looking up or down, you can see the upper and lower portion. But for this particular patient, you can see the all around, you can see the sclera. Okay, it could be because of various reasons. Like it might be because of the inflammation in the extraocular muscles or inflammation in the orbital fat. Okay, so that's why you find the sclera is visible around the iris. That's the main finding. Okay, that is finding in your CNS. Okay, so CNS, you remember it that way. Now moving on to the extremities and the skin. Okay, so for the skin, remember usually in Graves' disease, the skin is moist. Okay, especially hands will be sweaty and it's hot, that there is an increased temperature. Apart from that, the hair is very thin and the hair is sparse. Okay, and also what you find is in the shin area, okay, below your knee, you find hyperpigmented orange peel textured papules. So there are papules which are seen in the shin area and they will be hyperpigmented, okay, and they will have an orange peel like texture. That is something you keep in mind. Okay, so there's a small picture that I've drawn where you have the hair and the moist hands and the shin where you have the orange peel papules. Okay, moving on to your reproductive system. So here it's sometimes seen in men and women. Like I told you earlier, mostly it's seen in the women, but in the men, if they do have this condition, you find gynecomastia, okay, and impotence. These are the two things. And in women, you find infertility and oligomenorrhea. It's basically very closely related to the reproductive system in women, and your fertility and the ovaries, it's all related. So another day when we're dealing with conditions like PCOD or PCOS, I'll talk about that. But yeah, you find oligomenorrhea and infertility. Okay, so that is to do with your reproductive system. Moving on to your gastrointestinal system, you find that the patient is thin, right? So but there is increased appetite. So there will be an increased food intake, but you won't find weight gain. You'll find weight loss. So just to remember, so there's increased food intake. So but there's weight loss. So basically, you need to get this out, right, of the system. So you remember it as increased defecation and increased gastric motility. That's one way you can remember. Okay, so so these are the main clinical findings for your Graves' disease. Apart from that, whatever's covered is most important. We'll move on to the treatment. Okay, so for Graves' disease, what are the different kinds of treatment? So the most important treatment, remember, is radioactive iodine ablation. Okay, basically destruction of these thyroid cells which are producing excess of T3 and T4 by the radioactive iodine. Okay, that is the main course of treatment, and usually patients, around 30% of the patients, they're all right with that alone. But because you're destroying the thyroid cells, or thyroid releasing the thyroid cells, so what happens is the patient might require thyroid supplements. Okay, because their T3 and T4 will kind of fall, so you will have to give them supplements. Apart from that, so basically the main one is radioactive iodine. Apart from that, there are some medications. Some of them are mainly against the symptoms. So, for example, if you have your CVS, which is affected, so against increased heart rate and increased, against tachycardia, you give them basically beta blockers. They bring down the heart rate, right? So, you give them beta blockers like propranolol. Okay, that is one medication. Apart from that, you also have anti-thyroid medication like methimazole, polythiouracil, carbimazole, and all those things. The dosages of various of all these drugs, you can find it in various textbooks. You can go through them at your whichever textbook you prefer. Most of the textbooks have the dosage. So the dosages, you can find it in any standard textbook. The dosages for methimazole, polythiouracil, and your carbimazole. Apart from these medication, you also have surgery. So basically, when do you go for surgery? In conditions like when the patient is pregnant, you know that you can't use radioactive iodine, isn't it? So what happens then? So that's when sometimes, obviously not during the third trimester, and make sure the patient is safe. Surgery can be attempted. Usually what happens is, if a patient is diagnosed of Graves, you ask them to postpone pregnancy, or planning the conception or planning a pregnancy at least after 6 to 12 months. But suppose the patient is already pregnant, then you obviously have to do something. So that's when you go for surgery like subtotal thyroidectomy or complete thyroidectomy. Okay, so the thyroid gland is removed, a part of it, or complete. So what are the complications related to this? So what happens is you could either injure the internal laryngeal nerve, which is closely associated with the thyroid gland, or you could also be removing the parathyroid glands, which are closely associated with the thyroid, along with the thyroid. So that will kind of cause hypoparathyroidism. You need your parathyroid hormone for its own functions. So that will be causing hyperparathyroidism. Okay, so so these are different treatment modalities. You have your radioactive iodine, which is the first thing. Secondly, remember medications, and you have your surgery. Now, what else do you need to know? You need to know there is one condition called thyroid storm, or thyroid crisis. So how is the thyroid crisis or thyroid storm different from Graves' disease? So basically, you will have to remember there is fever. The patient will have hyperpyrexia. Okay, and many CNS findings like delirium, confusion, coma, and sometimes you also have heart failure, arrhythmias, tachycardia, and all. But otherwise, also you do have it in your Graves. But how do you differentiate a thyroid storm from a thyroid from a Graves' disease? Would be with findings like hyperpyrexia, fever, and your delirium, confusion, and coma. So these are the things that will you can, and it's a medical emergency. All right, you can't take it lightly. It is a medical emergency. Next, you will. So what happens is, another one important point that you will have to remember over here is your is your when you give them when the patient is under medication like anti-thyroid medication. So what happens is sometimes there is a thyroid hormone suppression, like I told you. Most of the times with these treatment you have to give them thyroid supplements, right? So when there is a thyroid hormone suppression, that is called as a Wolff-Chaikoff effect. Okay, WOLFF Chaikoff, CHAIKOFF effect. Might be pronouncing it wrong, but this is another important point that you need to remember for these exams. So whatever I've explained in this particular audio, you can find it in the picture that is being that you are seeing. So it's pretty clear, and yeah, hopefully it helps you in your preparation for your exams. And I'll be back with other helpful videos and helpful topics and helpful cases that will help you in dealing with clinical cases for all these licensing exams. And yeah, thank you.